Today we're continuing our discussion about chronic kidney disease and how we diagnose it in the first place. Really important to remember, it's a combination of both eGFR and albuminuria. You'll probably remember the heat map that you've seen many times in your studies, and it's really important to understand what exactly this means. So on the top left, you see that it's green, meaning good prognosis. There's no albuminuria and you've still got good GFR. But as your GFR decreases and albuminuria increases, your risk of complications goes up. We'll talk in the next video about how CKD can predict the risk of certain complications such as AFib, PAD, MI, and whatnot. But just remember that both of these numbers, the eGFR and the albumin to creatinine ratio, or ACR, are both really important. So some examples of how you might see this reported. We have, for example, a patient with an eGFR of 65 and an ACR of 79. That would be CKD G2A2. And if we had another patient with an eGFR of 115 and their ACR was 500, that would be CKD G1A3. Having both of these pieces is really important so that we can see where they are on that heat map. In terms of making the diagnosis of chronic kidney disease, there's a couple things that you're watching out for. Commonly, you'll see eGFR below 60, and it does need to be sustained for 3 months, hence the C in chronic kidney disease. Other examples would be an albumin to creatinine ratio, or ACR, over 30. And there's other things like persistent hematuria, structural abnormalities, and whatnot, but at that point I'm probably referring to nephrology. In primary care, what I manage most is chronic kidney disease related to hypertension and diabetes. So as you're diagnosing a patient, it's really important to say exactly what kind of kidney disease they have. CKD G2A2 secondary to diabetes. There have been many versions of the eGFR equation, the most recent being the 2021 CKD EPI. I really like that one because you can use not just creatinine like we always used to, but now there's a way to incorporate cystatin C, either getting eGFR based on just creatinine, just cystatin C, or a combination of both. And I'll link to the National Kidney Foundation's calculator for using both creatinine and cystatin C in the show notes. As we track patients over time, it's so important to remember that eGFR is just an estimate, hence the E, and not the actual measured GFR. In fact, if we look at studies, we can see that there is a big difference between eGFR and measured GFR in a way that impacts our patients. One study that I really like breaks down how much the eGFR and measured GFR differ. It's a little dated from 2012, so they're using the 2009 CKD EPI equation, but even still, a concept that they introduced that I really like is this idea of P20 and P30. And what that means is the proportion of samples where the eGFR is within 20 or 30% respectively of the measured GFR. The way they present their data, they kind of flip it on its head and say 1 minus P30. What this means, for example, for a patient with an eGFR less than 30, up to 16% of the time, their eGFR is going to be more than 30% above or below the measured GFR. And if we go with the P20, up to 37% of the time, a patient whose eGFR is reported to be less than 60 is going to be more than 20% above or below that. So what does that mean for my patients? I'm never going to use one value on its own. This also brings up the importance of cystatin C for additional accuracy when I'm making clinical decisions. We'll talk about some specific patient examples in future videos and how this might apply to your patient. But one common example is whether or not you would start metformin based on that eGFR of 45 that you got. Or if the eGFR was 30, do you really need to stop metformin, or is it worth getting a little bit more data? So now you have a sense of how to put your patient on the heat map using both eGFR and albumin to creatinine ratio. Don't forget to check it. And in the next video, we'll talk about specific complications and how we can use the heat map to predict the risk of them.